Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the 9 p.m. live English news edition, the top stories. Crisis meeting on the situation of the virus in Djibouti. A joint parliament government delegation reached out to the youth of Anglais. For the international news, at least 100 dead and 4,000 wounded in Beirut. Hello, welcome to our newsroom for having the news in details. The President of the Republic, His Excellency Mr. Ismail Omar Guelleh, in a telegram of condolences, expressed today, Wednesday, his compassion and solidarity to his Lebanese counterpart, Mr. Michel Aoun, whose country is the victim of a human tragedy following the explosion yesterday of a stockpile containing a high quantity of explosives. The people and government of Djibouti join me in expressing their sympathy and fraternity to the sister nation of Lebanon in the terrible ordeal of this disaster, wrote President Guelleh. We are all the more compassionate today with the Lebanon, as it is the victim of a disaster with multifaceted consequences, the head of state then noted. I hope that your country will quickly overcome the difficulties created by this highly dramatic situation, he continued. I also ask you to convey the sad condolences of Djibouti nation to the brotherly Lebanese people, to the family, relatives, and friends of the victim. The President of the Republic said, wishing a speedy recovery to the injured of this disaster, and the head of state added also, God mercy to spare Lebanon to recurrence of such traumatic experiences. And now about 2,750 tons of ammonium nitrate were stored in the Beirut port warehouse, which exploded on Tuesday, causing at least 100 deaths, according to the latest report released Wednesday morning by the Lebanese Red Cross, Dini Musa, with the details.
To 300,000 people are homeless after the explosions that occurred on Tuesday, 4 August 2020 in the port of Beirut, the Lebanese capital, announced the governor of the city, Marwan Aboud, who burst into tears at the scene of the disaster. Bodies lying on the ground, devastated buildings, broken windows for miles around, the carcasses of cars. Such is the decor of the side of the port of Beirut after the two enormous explosions, which were notably due to the explosion of some 2,750 tons of ammonium nitrate, a substance which enters into the composition of certain fertilizers but also of explosives. These explosions killed at least 100 people and injured more than 4,000, according to a Lebanese Red Cross report. The material toll is also very heavy, the government said. According to him, the damage, which affects half of the city, amounts to $3 billion. The blast was felt as far as the island of Cyprus, more than 200 kilometers away. In the evening, the American Institute of Geophysics, based in Virginia, specified that its sensors has recorded the explosions as an earthquake of 3.3 on the Richter scale.
Now in the capital, Djibouti, a fire broke out this afternoon in a wing of the Peltier Hospital's Central Purchasing Office for Medicines and Essential Materials. The fire brigade arrived quickly to contain the fire in order to reduce damage and losses, but a small part of the medicines and consumables stored in an old CMME building were destroyed by the fire. The risk of explosion, the oxygen plant, the burning structure, and the other CMMA buildings was eliminated thanks to the intervention of the fire brigades. The fire was not propagated. After several hours of intervention, the fire brigade managed to control the situation, and fortunately no human casualties were reported. According to the Health Secretary General for the Health, the fire started in an old building of the CMME structure where part of the stock was stored. However, the friendly fire put a strain on the operation of Peltier Hospital because of the huge, shocking smoke that engulfed the hospital and its surroundings, causing panic for the many patients and health care staff who were forced to evacuate the hospital at a time of writing. The situation is gradually returning to normal, although the structure that caused fire is now giving off a shocking smoke. An investigation has been opened by the Public Prosecutor's Office to determine the origin of the fire. According to the fire and first information we have, an electrical circuit will be at the origin of this fire, that the most important one that Piltry Hospital has known up to now. The officials, including the Prime Minister, the President of the Assembly, the Minister of Health, and several members of the government, have traveled to the place of the fire to see the situation more closely. The first ordered a quick assessment of the CMME's losses in this fire. It should be noted that CME has several storage depots for medicines and sanitary materials, particularly in Balbala. This fire only affected the number one structure still in Peltier. Now let's listen to the intervention of the fire brigade colonel who brought the fire under control.
Today afternoon there was a fire at Peltier's CAMME. Thank God there was only one shed that caught fire, but it was contained. We tried to protect the Peltier Hospital's reserve for their oxygen tanks and everything that can be saved at the hospital. At the moment we have the fire under control, and we are in the process of the last fire extinction of the fireplaces that we have left.
Following the laxity noted by the Djibouti government on the non-compliance of barrier measures against the spread of COVID-19, Prime Minister Abdelkader Kamil Mohammed today held a meeting at the People's Palace. Presented the meeting where the Health Minister, Mr. Mohamed Warsama Dirie, the Defense Minister Hassan Omar Mohammed, the Chief of Staff of the National Gendarmerie, Colonel Zakari Hassan Aden, the General Manager of the National Police, Colonel Abdullahi Abdi Farah, the Scientific Committee for the Fight Against the Coronavirus. Precisely during this meeting, there was a discussion on the slackening of the population during the preparation of the Eid al-Adha and during the Eid festivities on the non-compliance of the COVID-19 prevention measures put in place by the government of Djibouti. The objective of this meeting was to find a strategy to fight even more against COVID-19, also to strengthen the human and material means to benefit in order to shelter from a second wave of contamination by COVID-19. The Prime Minister reiterated the importance of respecting the barrier measures and called on the population to be vigilant by insisting that the virus was here still. Now the Minister of Health, Mr. Mohamed Warsama Dirie, made an intervention expressing his views. Let's listen to him.
Nous sommes réunis justement parce qu'il a été constaté.
Today we are meeting precisely because it has been noted that the positive case in Djibouti has increased. The Prime Minister has called a meeting so that we can find a strategy to reduce the number of positive cases in particular and to raise awareness among the population. Everything that concerns barrier measures. As you know, we have been successful in the last 2 months. We are seeing with great satisfaction a decrease in positive symptomatic cases, but also in serious cases. And as you know, the positivity rate in Djibouti has varied between 1 and 5% since the last 2 days before the Eid. The positivity rate also reached 15% during the Eid. There have been many gatherings in public places, and we are also seeing a significant increase in positive cases in the Republic of Djibouti. So that is why we are asking the population to respect barrier measures, and especially the wearing of masks, hand washing, and social distancing.
Now, within the framework of the proximity policy instilled by the President of the Republic, His Excellency Mr. Ismail Omar Guelleh, a delegation led by the Speaker of the National Assembly, Mohamed Ali Mohammed, and composed of the Minister of Women and Family, the Budget Minister Abdul Karim Aden Sher, the Mayor of the city, Mrs. Fatima Awal Osman, and several parliamentarians went yesterday, Tuesday afternoon, to have a consultation meeting with the representative of Youth Association of the Hayable sector of Balbala. The main objective was to exchange with the dynamic Youth Association of Hayable, largest Balbala district, gathering the youth of 17 Hayable actors. The delegation held the meeting to inquire about the situation of this district and especially the youth of Hayable, possibly find solution to their problems. The youth of Hayable thanked the delegation for the visit and said that they are the results of the president's policy in favor of Djiboutian youth. In their speech, the youth of Hayable affirmed that they always remain mobilized alongside the President of the Republic, like the members of the government, to support the political vision of the President. The mayor now thanked the youth of Hayabley for the warm welcome to her and her delegation. She was pleased to have a close exchange with the young people of Hayabley who are motivated and show a spirit of solidarity and who are determined to develop their district in Djibouti city and to participate in the evolution of the country. The duty of the decision makers is to fulfill the needs of the population, especially the young people. And the President of the Assembly thanked for his part the youth of Hayabley for the warm welcome he and his delegation received. He was delighted to have a close meeting with the youth of Hayabley, mobilized and supportive, concerned about the development of their Hayabley district in the city of Djibouti, and who aspire to participate in the progress of the country. The responsibility of decision makers is to meet the needs of the population, especially the young people. Now, a communique, the Djibouti Port Authorities draw attention to the compliance of all facilities with the international security regulation in force with regard to the handling of toxic and dangerous goods. Port officials claim that all infrastructures owes this to its rigorous and systematic compliance with the standards and codes issued by the International Maritime Organization, which set out the procedures for handling and securing explosive and flammable projects. Above all facilities owe their ability to prevent the slightest risk of accident involving toxic projects within their consent to legislation, in particular a presidential decree adopted in July 2007. This decree ratifies for the purpose of rigorous application products and goods, in particular toxic gases, radioactive materials, organic peroxides, flammable liquids, defined as highly dangerous by the World Maritime Organization. It prohibits storage of these substances in Djibouti's case of free zones and sets out the end-to-end security protocol for the handling, processing, and management of these projects from their arrival in our ports to their final destinations. And now the Health Minister, Mr. Mohamed Warsam Adiri, yesterday launched the measles vaccination campaign in the presence of the UNICEF representative, Mrs. Maelva Johnson, and WHO Deputy Representative, Dr. Eddie Allen. The launch ceremony took place at the 15 Polyclinic in Warabele in the compliance with the COVID pandemic barrier. Indeed, after the regional campaign, this new measles vaccination campaign is now targeting nearly 212,000 children in the capital, aged between 6 months and 15 years old. The ministry and his delegation then took a guided tour of the polyclinic in the company of the head doctor, Dr. Ayub Mohammed, who presented various services and specialized services in ophthalmology, laboratory, and ultrasound, as well as the maternity services, where the delegation handed out baby toilet kits to mothers. The Minister of Health, Mr. Mohamed Warsam Atiri, and his delegation symbolically attended the vaccination of the first children. The official start of the official launch of this measles vaccination campaign. More than 200 vaccination teams will travel around the capital for 8 days to provide immunization protection to all children in the capital. In this difficult context of the COVID-19 pandemic, the health minister wished to emphasize the importance he attaches to this mass immunization campaign aimed at ensuring effective protection for all children against measles. Taking part in the launch of the measles immunization campaign, the representative of the UNICEF and WHO welcomed this initiative by the government of Djibouti to ensure full protection of children against measles. Let's listen to them.
The whole world is going through a health crisis, which is the COVID crisis, and we all know that at that time there were limitations used of service. We have also seen children who have not caught up with the immunization schedule, and it has to be said that the commitment, which was the government's commitment to be able to organize this campaign against measles, is very much appreciated. We dare to hope that children will build up their immunity and that we will do everything we can to disrupt the global modeling that predicted that there would be an outbreak of vaccine-preventable diseases or epidemic potential diseases, which we simply want to reiterate the WHO commitment to always be able to be at the side of the Ministry of Health. We are here today in the launch of the measles immunization campaign and UNICEF. Truly, I would like to congratulate the Ministry of Health and even the Minister for his commitment to vaccination and the protection of children. I would also like to congratulate all the parents who have come here today because it shows that they are very, very committed to the protection of these children and the whole team of hospitals that will be providing the service to the family. I am very, very proud of you.
For his part, the national coordinator, Dr. Abdurrahman Mumin, recalled the objectives of this measles vaccination campaign to achieve 95% immunization coverage at the national level. Now, the General Secretary of the Health Ministry gave us the daily press briefing of today. The data of COVID-19 pandemic is as follows: 464 were performed, 82 positive cases of COVID-19, 13 cases cured, and 0 death. Please stay alert, protect yourself and the others. Now in the UNFD, still in the news of the country, the UNFD headquarters hosted this morning a ceremony to hand over medical equipment. Let's listen to the following reports.
Headquarters hosted this morning a ceremony of handing over medical equipment consisting of surgical masks and non-contact thermometers offered by Mrs. Lian, wife of the Chinese president. The ceremony was attended by the Chinese ambassador to Djibouti, the Minister of Women and Family, Mrs. Momin Muhammad Hassan, Vice President of the UNFD, Hassan Ahmad, as well as the Secretary General, Fatuma Musa, and some female deputies. The donation of materials, which was composed of 18,000 masks and 120 thermometers, was given to the Vice President of the UNFD. The Chinese ambassador to Djibouti gave a speech in which he explained that the world is going through a health crisis and that Djibouti has supported the Chinese government in this event. Today, it is with real pleasure that I am here to present you, on behalf of the Chinese government, a donation of medical supplies. This donation of equipment consisting mainly of 18,000 surgical masks and 120 non-contact thermometers initiated by the First Lady of China, and what is especially dedicated to support the women and children of Djibouti in their struggle against COVID-19. A sign of the friendship and solidarity for Chinese people towards the African peoples. For several months now, we have been going through an unprecedented health crisis in the memory of all of us. In these difficult times, under the leadership and commitment of Her Excellency Mrs. Khadra Mahmoud, First Lady of Djibouti, UNFD has made considerable and fully mobilized efforts to help women and children in Djibouti.
For her part, the Minister of Women and Family, Mrs. Momin Ahmed, took this opportunity to express the sincere thanks. Let's listen to her.
Nous sommes réunis au siège de l'UNFD pour réceptionner un don de matériel.
We are gathered at UNFD's headquarters to receive a donation of equipment for the fight against COVID-19 offered by the government of the People's Republic of China through Mrs. Beng Yin, wife of the President of the People's Republic of China. This donation of equipment is addressed to Mrs. Khadra Mahmoud Head, First Lady of the Republic of Djibouti and President of the National Union of Djiboutian Women. Mrs. Khadra Mahmoud Head, First Lady of the Republic of Djibouti and President of the UNICEF, extends her sincerest thanks to Mrs. Beng Yin, wife of the President of the People's Republic of China, for this donation of equipment for the population. This donation of equipment is intended for the population of Asian Djibouti and in particular for the most vulnerable category, for example, women and children. Our First Lady always remains attentive to the most vulnerable populations, remains attentive to the population in general, and to women and children in particular. Whatever the situation they face, our First Lady, Mrs. Khadra Mahmoud Head, strongly believes that the commitment and actions undertaken by all the leaders of all countries and the close cooperation that exists between the various countries will make it possible to defeat this virus and to preserve the population in general and the most vulnerable population in particular. I will conclude my remarks by recalling that relations between the People's Republic of China and the Republic of Djibouti have long existed and have been strained in recent years. I will conclude with these three words: long live our peoples, long live the People's Republic of China, long live the Republic of Djibouti.
The Ministry of Labor in charge of the reform and the administration, in collaboration with the Executive Secretary in charge of the reform of the administration, hosted last Monday in the large meeting room of the INAP a training workshop focusing on the learning of spraying techniques and administrative premises intended for public administration executives. Awareness and prevention was the watchword of the training workshop for COVID-19 last Monday at the National Institute of Public Administration. This training workshop took place for 3 days in the presence of about 50 public administration agents who had the task of acquiring knowledge and practices in the field of COVID-19 preventive. Organized by the executive secretary responsible for administration reform, this program was financed by the UNDP with a view to strengthening the know-how of public administration officials in the case of COVID-19. It is also intended to train participants in spraying techniques for administrative premises, prevention and sensitization, such as the respect of instruction, barrier justice, the wearing of masks, protection in case of contact with people suffering from coronavirus, and finally, a teleworking session targeting the problems arising from the pandemic. The training was facilitated by an expert from the National Institute of Public Health who focused on techniques and practices adopted in the workplace. Now, as part of the reopening of the borders in our country and with a view to preparing the entry point for the resumption of activities, the Health Minister through the National Institute of Public Health in collaboration with the International Organization for Migration organized training on infection prevention and control measures and compliance with the International Health Regulation 2005 at Gaddafi entry points. In this regard, a team from the Ministry of Health composed of the General Director of the NSPD, Mr. Farhan Ali Mohammed, Dr. Ibrahim Mohammed Ibrahim, Director of the Health Monitoring Pole, and other executives responsible for border quarantines in the presence of local authorities. This 2 days training, which was held in the meeting room of the Regional Council of Dakhil from 3 to 4th August 2020, saw the participation of the agents of the various departments operating at the land entry point of Gaddafi, and namely the immigration police, the gendarmerie, the customs, the sanitary quarantine team, the chief doctor of the region, the ambulance driver of the CMH, the sub-prefecture of Yabuki, the local elected officials. The first day focused on acquiring theoretical knowledge of the topic in question, and the second day on practical stimulation on the management of a sick case of COVID-19 at the Gaddafi entry point. Still, as part of the response strategy of COVID-19, ONARS has set up a quarantine center in Al-Sabih in the locality of Arausa. This quarantine center is intended for migrants from Yemen who are stranded in Djibouti because of COVID-19. This quarantine center for migrants is managed by ONARS in collaboration with the National Police, the Prefecture of Al-Sabih, and the Red Crescent of Djibouti. All migrants who cross our borders pass through this site to be tested and treated before being voluntarily repatriated home. As soon as they arrive, these people are tested for COVID-19 by a medical team dispatched by the Health Minister and installed in this site. After the test, the migrants are registered by the ONARS migration team and are then settled under an owned to be treated, fed, clothed, and housed in this quarantine center during the 14-day treatment period and are repatriated to their countries in good health. Djibouti welcomed all migrants crossing our borders during this period of COVID-19 and installed them in the Arausa quarantine site, which is the first quarantine site in the world for migrants. Moving now into the international news, in the United States has recorded 1,300 deaths in the last 24 hours. Let's listen to this report.
The United States has recorded 13,002 new COVID-19 related deaths in the last 24 hours, according to the latest Johns Hopkins University count. This brings the total to more than 156,000 deaths recorded in the country since the beginning of the pandemic, which began in December in China. The United States has also recorded 53,847 new cases of infections in one day, for an official total of 4.77 million infections, according to the Baltimore-based university. While the country is by far the most affected by the pandemic in the world, President Donald Trump is optimistic. There are indicators that our strenuous efforts to contain the virus are actually working very well, especially in protecting the most vulnerable, he said at a White House press conference on Tuesday about the health crisis.
This is it for this edition, ladies and gentlemen. Thank you for watching us and have a wonderful evening.